Hello, and welcome to our webinar entitled Introducing TaskForce, ISMS's newest partner. I'm Lindsay Josephs, the Senior Manager of Marketing and Outreach here at the Illinois State Medical Society. We're very excited to have two wonderful speakers with us today, Ron Bova and Dana Dove, as we introduce our newest benefit partner, TaskForce. Ron has been with TaskForce since January 2018 and is one of 6 TaskForce owners. His current role is the Chief Business Development Officer. And in this role, he works closely with the healthcare and insurance customers. Dana has been with TaskForce since March of 2019 and is the healthcare services consultant there. Dana has more than 20 years of experience working in the medical claims and billing field. One important feature for today's webinar that you should know about is the chat function. At any time during the webinar, you can enter questions that you have into that chat box. Dana and Ron will answer your questions at the end of their presentation. And if we don't get to all of the questions in the time that we have today, your questions will be answered later. Without further ado, I will turn it over to you, Ron and Dana.
Thanks, Lindsay. First, I'd like to start off by saying thank you to the Illinois State Medical Society for partnering with TaskForce. We're looking forward to working with your members across the state and just developing a great partnership with them. We're excited to do this for you. So we prepared a PowerPoint presentation just to give you a brief description of TaskForce about who we are and what we're doing. So let me get started with that. But TaskForce is basically, we're a business outsourcing company. We're located in the country of Macedonia. We have 5 different verticals that we work with: healthcare, insurance, logistics, accounting, and customer care centers. TaskForce, as Lindsay mentioned, we're American owned and managed. We have 6 of us partners here that own TaskForce. 5 of us are located here in the United States. Our partner Atso is in Macedonia. He acts as our CEO there and in charge of our entire operation there. So we're headquartered in Knoxville, Tennessee. It's pretty much a family business. We started it 7.5 years ago. My 5 partners are Macedonian descendants from immigrants, and I'm the only one that's not Macedonian, but there's 5 of us here on the U.S. side. And it's kind of a neat thing because we have a strong business relationship here on the U.S. side with all of our contacts, as well as the business that we're building in Macedonia. So the company was launched, we're relatively new, about 7.5 years ago. We started with 1 employee, just basically checking policies on the insurance division we developed. And today, by the end of this year, we're going to have close to 2,400 employees working in those 5 different verticals. And each of them are spread just about equally. There's about 450 employees in each vertical right now for us. So we're adding 50 new employees a month. Our business is rapidly growing, and we're excited to work with you and help service your practices. So the challenges, this is what we face. We hear this, every week when we're on calls, hear what's going on in the U.S. And it's just the lack of workers and the price points that are being charged to get these quality workers here on the U.S. side. It's a very competitive labor market here in the U.S. They're experiencing a lot of high turnover. Healthcare costs, insurance costs are going up, and just the rising minimum wage in the different states. So why outsource? Outsourcing primarily, there's low turnover, especially with TaskForce. And I'll get into the turnover pieces. That's kind of important when you're dealing with outsourcing companies. But at TaskForce, we provide dedicated teams. I think that's been one of the keys to our success. A lot of our competitors you really don't know who you're working with. We want you to treat these employees like they're your own, like you're hiring here in the U.S. There's a significant cost reduction when you're outsourcing. Obviously, quick turnaround time on the tasks that we perform, and just improve effectiveness across the board on the work that we're doing for our clients. So again, the Macedonian value. These are some important pieces, and I'll kind of go through some of these, but just the European quality standards. We're EU compliant. Macedonia is a NATO country, and I think that's very important when you're working. We became, with countries outside the U.S., we became the 30th partner in NATO within the last, I think it was 2 years. We have a high education standard there in Macedonia. We have high unemployment, very similar to what we have here in the United States. 98% of our TaskForce employees, they have college degrees, very well-educated culture. And most of our employees, they're multilingual. So it's very helpful with the call center work that we perform. English speaking skills. Again, I can't speak enough about that because that's probably another one of the key selling points for us. We want you to have that direct communication with your employee. Our employees learn English it's mandatory in the country. They learn English from kindergarten all the way through their second year of college. So I laugh because they speak sometimes better English than most of my friends. And then, let me go back to that. I want to touch on turnover here. So industry turnover, TaskForce, we average about 9.5%. Industry standards is running around 25 to 30%. And in some of the other markets out there, it's as high as 50%. So in this particular business, turnover is very important because you can't really develop continuity if you've got to be training and constantly hiring new people. So we've been very successful with keeping that close-knit in the country of Macedonia. And just to give you an idea, so if you look at the slide here, that just in general, global industry benchmarks, call center work, you see about 40% turnover. General BPO business is around 20. If you look at the US, we have high turnover here as well, 37.5% on call center work, 63.3% on the general BPO. And then I included India and the Philippines. These are both great countries to outsource in, but they experience really high turnover as well. And then you look at TaskForce in our European market in Macedonia. So our call center is around 23%, and our general BPO is at 9.5%. And those are really probably really good benchmarks for the industry as far as what outsourcing turnover should look like. So again, this is a general presentation, but I want to talk about specifically, we're going to get into healthcare and our customer care centers. But these are the things that we're doing on the healthcare side. So we provide real-time RCM service support for one of the largest healthcare providers here in the United States. We provide quality control and audit services for Fortune 500 companies. We have a logistics company they're headquartered here in the United States. It's an $8 billion revenue company, manufacturing bottled water. And this number is a little bit higher, that we take over 10 million patient care calls from a large multi-specialty physician groups, and these are across the country. So that's inbound, outbound calls with patients, doctors, nurses. Customized solutions for multi-billion-dollar insurance brokerage firms. We do a lot of insurance work with insurance companies, insurance agencies, and brokerage agents across the country. And then what's important too, I think since day one we opened our doors, we started learning we're system agnostic. We work off of just about any system that's out there. So our approach, we provide dedicated teams, as I talked earlier. This is really important because, again, if you're going to develop a continuity, it's important to provide those dedicated teams. Our clients like that. They like to have their people, their staff take care and support and service their clients, and they want to give us that back office administrative work. That seems to work very well. All of our teams are certified, and we have experts here on the U.S. side. There's about 22 of us here on the U.S. side that are considered subject matter specialists. Dana, who'll speak here soon, she's one of them. She heads up our healthcare division here on the U.S. side. And we're continually training our people and getting them through our TaskForce Academy, where they're constantly learning the ways of the U.S. market. And this is an approach we've taken with all of our verticals. So you start in the center with the client. We start off by identifying your problems, define the task. We set objectives, we establish guidelines, establish your KPIs, and then you can kind of just work your way around, the center. We're going to consult with you first. We start looking at implementation as far as establish tech systems, syncing, building workflows, set up the KPI metrics, define skill sets and talent, establish the training and schedules, train the trainer. I think this is very important. We always start small. It seems like we start with 1 employee, 2 employees, and then from that first training, it's on us after that, because we train the trainer. You train us one time and then our people take over from there, unless you're going to train us on a different task, but we take that burden off you. That works very well. We get into quality control. That's obviously a big part of what we do. We establish our QC teams. Right now we QC anywhere from 5 to 10% of the task. We set these guidelines. We measure the quality and productivity, training lessons, and we retrain from lessons learned. Reporting, we have a full array of reporting that we can provide I think the Power BI is probably the most important. We have a member portal that you can sign into. You can look at your actually real-time numbers on a daily basis, weekly basis, monthly basis. Data is important in this business. We want to make sure that you have access to that. Review and refine. We establish these touch points, review production, quality matrix, set additional training, refine the KPIs, and reestablish new goals, and then scaling. We know that if we do a good job, we start with one person. We know when it's time for you to scale up, you can come to us, and we can take care of that for you as well. So again, primarily today, we're going to talk about healthcare and our customer care division. These are just, again, the 5 divisions that we operate in. So healthcare, again, this is a very short list. Dana will get into this in a little bit more detail on the last slide, but basically on the healthcare services, we look at medical coding, medical billing, real-time coding, claim submission, virtual medical scribing, and physician credentialing, basically the full RCM piece. And then the customer care support services, again, we're taking inbound, outbound calls. We do scheduling, customer care management, medical records request, after-hour services. So there's a lot of different areas where we can help you out. I thought I'd add this one testimonial. So Todd Vang, he's the vice president of the Aspen Group in Chicago here. And I'll take a second, let you read through that. But this is what we strive to do for all of our clients. We want to make sure that when we set these up and we set up and learn from you on how you like things done, that we're performing in that standard. And we want to make sure that we're servicing you the way that we're supposed to be servicing you, because we know that if it works, again, you're going to come back to us for more resources when needed. And lastly, next step, again, we start slow. We say 1 employee. So if you're not familiar with outsourcing, or if you're currently outsourcing, we suggest, if you've got a backload of work that you need to catch up on, or you're looking for a new hire and you're having problems with that, just try 1 employee, see how it works. Because again, we want you to treat them just like you're hiring someone locally. If we start slow and we do a good job, we know that when it's time to add new resources, you're going to come back. And again, we're developing partnerships. We're in this for the long haul. It's not a 1-year deal. We want to try to work with you and have it. And as your company grows, we want to grow with you. So now I'd like to introduce Dana. Dana is going to get into a little bit more detail on what we actually do internally with our healthcare clients and some of the specific areas that we touch.
Hello, everyone. My name is Dana Dove, and I'm the Vice President of Healthcare Services with TaskForce. I'm located in Columbia, South Carolina. I have 22 years of RCM experience, and I started my career for a large payer, Blue Cross Blue Shield of South Carolina. During my tenure, I worked in provider education and relations. This provided me with invaluable experience and knowledge of the inner workings of the life cycle of a claim. Eventually, I joined the provider side and working for PricewaterhouseCoopers Virtual Business Office in a project-based environment on both facility and professional claims. I've also taught coding and billing at a local college and worked as a coding auditor and educator for one of the largest urgent care chains in the U.S., as well as pain management. And moving into the flyer that's shared on the screen, as Ron mentioned, obviously with outsourcing, there is a reduced overhead cost. Traditionally, many RCM vendors are paid based on a percentage of collection or revenue collected. TaskForce operates a little different in that we charge a flat hourly rate, and this allows for easier forecasting for budgets and the work that we do. We've helped many of our clients increase productivity and daily volume of patients seen. For example, some were previously using a nurse to complete their prior authorizations. This resulted in increased overhead due to nurse and salaries and decreased number of patients seen, as the nurse was spending a good amount of time on the phone with payers and simply sometimes just being on hold on the phone. Now that we are doing authorizations, the nurse is able to focus on patient care, returning patient phone calls timely, and triaging patients, which allows them to see a higher volume of daily patients. Also, we help with workflow processes improvement. Oftentimes in the RCM space, we get so caught up in our day-to-day that we don't really think about all the steps that we go through. During our onboarding and training process, we often find areas of opportunity for improvement, and we share with our clients and work through them together. For example, we were able to reduce one of our dental clients. The breakdown forms they were using, we took them from 9 pages to 3 pages, increasing the amount of patient eligibility and verification breakdowns we were able to do daily. Medical coding, real-time. TaskForce was a pioneer in real-time coding with the largest urgent care chain in the country at the time. By coding in real time, it allowed the client to reduce patient bad debt and patient AR and increase point of service collections by 65%. By coding claims prior to the patient's departure, we were also able to improve clinical documentation. As many of you know, in urgent care and some other specialty settings, providers may have a break in the shifts worked. They may not come back for a couple of days, and it's really hard to go back and get that documentation with the addendums in there. By doing it real time, we were able to capture it in the moment. For example, if a provider completed a laceration repair and they did not document the length or the depth of the repair, coding guidelines state it has to be dropped to the lowest level, and that means revenue is left on the table. Our team sends secure messages through the EMR system to notify the provider, and we were able to get addendums again in real time. We were also often finding missing ancillary charges such as labs and x-rays that we were able to capture in real time as well. It reduced the loss on DME equipment that's not covered in an urgent care setting by CMS, and we rarely would see an ABN on file. So those are just some of the things that we were able to do just in a real-time setting. Due to the time zone difference, batch coding has significantly reduced the days not billed. Macedonia is 7 hours ahead of Central Time. Our first shift is 7 to 3 local time, which is 12 to 8 a.m. Central Time. So if the charts are completed or signed at the end of the day, our teams are coding the charts overnight and charges can go out the door the next day. Our teams are agnostic and they adapt to your systems. We generally use a VPN or a cloud-based EHR program. Some of our vendors scan or place electronic charts into a designated folder, and our team picks them up from there and we do the rest. Several of our clients use systems that require a different workflow, and charge entry is actually a separate step in getting the claims out the door. We do this currently from within the EHR or PM system or from super bills or charge sheets that are scanned in manually. And then we just simply enter the charges. For clinical documentation improvement, I touched on that a little bit with the real time. But we also send physician queries, and we have open communication with our client contacts on any questions we may have. Some of the surgeons that we code for, they also code their charts. And if there's ever a discrepancy or if we have a disagreement or a question, there's open dialogue before that claim goes out the door. We also provide coding education and audits. Just yesterday, we spoke with a new dermatology provider, and she has some questions on the new E&M guidelines and why their system, they have a computer-assisted coding software program, and she was not understanding why she was getting some of the code assignments that she was. We were able to pull up a test patient, walk through a test note, and show the provider exactly what to do within the note and explain why she's getting the results that she's getting. And of course, she was very grateful for that, but it's just, that's not something that we often see with a lot of coders, and that is a service that we pride ourselves on. For many of the new providers, we provide education and training when they are first starting with the coding with the client. Many providers do not get any coding education through medical school. So we will get on the phone with them through a webinar. We will go through any of the coding questions they have. We walk them through the guidelines, and then they see patients, and then we will come back afterwards, 3 months, 6 months, sometimes a year, just whatever we decide on with the client. And we will do another audit, and we will have another call with the client one-on-one, and we will go through anything that we see with that provider. This is what we talked about in the beginning. we're seeing you're doing great with this, and we have some opportunities for improvement with some other things, and we provide all that information. Obviously, medical billing is a key part of our RCM offerings. We submit claims daily and work the rejections and provide feedback to our clients on best practices to reduce the rejections. And this is an area that I've often heard other vendors say they feel the coding aspect and the claims need to be worked separately. We see it a little differently because we want to close that communication gap. So by looking at these denials and looking at these rejections, we're able to provide that feedback to our coders and to the clients to reduce the overall number of rejections. We also do payment postings, and our best practice is payments should be posted on the date of receipt or as close to the date of receipt as possible. We've worked with a number of clients that had incomplete or payment postings that were going back several years. If they're trying to post a remit electronically and it doesn't balance for a refund or whatever the case may be, it may just be one patient, but they would not. I think our last one was maybe 4 years worth of remits that were not posted completely because of, maybe 1 or 2 problematic patients. What this does is result in skewed data, and it makes it hard for you to get an accurate picture of your outstanding AR, as well as difficult to send patient statements. So we do believe in priding ourselves on getting that payment posted quickly. We provide AR follow-up and make outbound patient calls. Our teams work in a HIPAA secure office environment and are able to process payments over the phone. And I do want to make sure that we point out that this is prior to the patient being turned over for bad debt collections. TaskForce handles full RCM end-to-end with the exception of bad debt collections. We handle denial management, including everything from coding-related denials and submitting appeals on complex surgical cases to submitting proof of timely filing and everything in between. Earlier today, we had a client come back and said, hey, how are you guys getting these proof of timely filing, to the payer? How are you getting your appeals overturned? We haven't been able to successfully do that. And it's because all of their AR staff did not have access to their clearinghouse to get the proof of timely filing. And that's one thing that we pushed for when our team came on board. And once we got access, we submitted a backlog of appeals for timely filing, and they're actually seeing payments on it now. So they're going to be changing their internal workflow processes as well. We are currently working with one client and the State Department of Insurance. A payer is erroneously denying some of the remote patient monitoring codes. And previously, the client's instruction to our team was submit appeals. And once we really started looking into it and realizing it was the payer system, until we get the payer system corrected, we're always going to have to, every claim is going to be denied, and we're always going to have to submit appeals. So we're working with the client and the State Department of Insurance to work with the payer to get their system updated. Credit balances is an area where we start with many of our clients. Traditional outsourcing vendors are a little hesitant to take on credit balances because they're typically set up as a percentage of collections. They're paid based on a percentage of collections, and we're set up on the hourly fee. So it's a little bit easier for us to work on. We've taken on some clients that had credit balances going back 10 years. It is important that those are worked, and it has landed on the OIG's work plan. It picked up a little speed during COVID, and other audit areas were on hold during the PHE. Each state has different laws. We work within those laws, within the guidelines. As we all know, CMS says you got 60 days to turn it back to us. So we go through each and every single one of them and research those accounts. We've often find ourselves in a position of the accounting department saying, please slow down. We can't get all the payments out the door fast enough. But we do work them, get them cleared out. If it's an incorrect adjustment, we take care of that, which is often the case. Moving down for our patient care, we have an inbound call center, and we can provide patient scheduling, patient registration, insurance verification, and referrals prior to the visit. This is helpful when there's a front desk staff shortage, call volume overflow, multiple locations. with a high front desk staff turnover. We function as a centralized business office in that regard, but it's just for the phones. The front desk is usually an area that requires constant training. And by using that centralized call center and patient care coordinators, our clients have seen an increase in patient satisfaction and a decrease in eligibility and benefit-related denials. We also offer virtual medical scribing and transcription services. And as Ron mentioned earlier, we have access to a highly educated workforce. And we've literally had dentists working as a scribe for US-based dental practices. And we saw much success with that. Prior authorizations is at the top of the list of heavy burdens, I think, for every practice. We've been able to remove that for many of our clients. We all know authorizations are required, but many times practices just simply do not have the resources or the bandwidth to complete them. We've reduced overhead costs by removing those from RNs doing it now. And we complete the prior authorizations for procedures as well as specialty drugs and biologicals. And as many of you may know, when specialty pharmacies enter the picture, it adds additional steps and follow-up time. And we handle it from end to end, including follow-up phone calls to the patients to make sure their drugs were delivered. On the right side of the screen, we have a list of specialties that we are currently working with or that we have worked with in the past. This is not limited, and we are very open to adding new specialties. We utilize all coding resources available and any specialty training. We have several coders with multiple certifications and are always looking to gain knowledge. All of our coders are AAPC certified. Our trainers go through the AAPC billing curriculum and eventually sit for the billing exam. And then some of our specialty coders are certified in derm, urology. Multiple coders are certified in general surgery. And if there's one listed that you don't see, please feel free to reach out to us. We would love to add it. As Ron mentioned, we started about 7.5 years ago, and we will be over 2,400 by the end of this year. I think that's all I have for now, Ron.
Thanks, Tina. At this time, I'd like to open up for questions. Let us know if you have any questions for us.
There actually have been a couple that have come into the chat here. So the first one, Ron, I think you addressed this earlier, but the question was, what EHR do we need to use?
EHR, we're agnostic. So we use whatever system the clients are using, generally with a VPN, direct connection, or if they're cloud-based with a login.
Okay, thank you. And then are there a la carte options?
Yes. Many of our clients, as I said, they started with credit balances. You don't have to do the full RCM end to end. If you need help with prior authorizations, we're happy to start with that. So whatever you need help with, we're glad to be here.
Wonderful. And then there is just one more question here. And it is, how is PHI, which is personal health information, handled?
Sure. I always mess up the name. I believe it's SOC, the SOC certification, Ron. Yeah. Our teams do not work remote. They work in a secure office environment. Is with a key card, to get in the door. It's SOC certified. We have clean desk policies. They're not able to save anything on their computers. And we use our client server, so nothing is stored in our system.
Okay, wonderful. I think those are the only questions that we have here. We can just give it a second in case any others come in. And while we are doing that, I will just say, again, we are recording today. So thank you for participating in today's webinar. Within the next 2 weeks, you should be able to access this webinar either on our education platform, which is found at isms.org/education, or we will be hosting it on our YouTube channel as well and sharing it on social. If you can also find other webinars on other issues, including sexual harassment prevention, telemedicine, opiates, and prescription safety, public health, and legislative updates on our education center as well, which again is www.isms.org/education. It does not look like any other questions have come in. So with that, thank you all for joining us today. Ron and Dana, thank you so much for that information. And I hope you have a great rest of the day. Thank you.
Thank you, Lindsay.